was it like doing this documentary, and what was most surprising to you during your journey here?
Well, clearly I like to keep things light. I'm just kidding. I like to tackle, I think, difficult subjects because I feel like the most, we learn so much about resilience and the human condition in these ways. And I felt like this was a really important film to make. Sheila Nevins had brought the idea to me and she wanted me to do it for MTV. And I really felt very strongly that this was something that needed to happen. And I understood the intense need for this to be talked about. And I think the thing that I was most surprised about was that, for my generation, there's more of a stigma. And I know that some of the subjects in the film talk about the stigma, but I was so impressed with the young people and their ability to talk about mental health issues and to really open up, and how much they wanted to give back was really incredible.
Yeah, I think that's one of the things that's most striking to me. I mean, listen, I'm a millennial, and it's not something that was talked about even when I was growing up. And Dr. Whitlock, I'll bring you in here because when you think about Gen Z, they're dealing with mental health in a different way. They've had social media their whole lives, right? They're talking about it, they're dealing with it, but yet the suicidal thoughts are still there, even though we are having these conversations. So what was it like for you to just think about everything involved here?
I mean, it was really fun to work on. I didn't know what to expect when I started to speak with the young people in terms of sort of how the conversation would go, but they're all incredibly articulate. They were really knowledgeable about their own experience and able to connect it to the experience of other people. I thought the combination of young people that were talking about their stories was just extraordinary. And I am really struck by the capacity of Gen Zs to talk about these issues. But like you say, we still see a lot of mental health issues, which I think points to two things. One is talking isn't usually enough. It's enough, it's the beginning, but it's not enough. And the other is that we have raised children in a contributor to anxiety, depression, and a whole bunch of other kinds of conditions. So we've increased our capacity to talk about it, but we've also increased the inputs that create the conditions in the first place.
Yeah, and I mean, all of this was going on already, and then Alexandra, you throw a pandemic into it. So kids are not going to school. Kids are not seeing their friends anymore. They're on social media more. They're completely enveloped by their own thoughts. So how did the pandemic factor in everything here? Because this is filmed with these 9 kids at home dealing with all this, but what's most striking about the impact of the pandemic on mental health and suicidal thoughts?
Well, I mean, I would say that I think Dr. Whitlock can speak more to this than I can in terms of the increase. But I did think what I was really struck by when we first connected on Zoom was this idea that here we all are dealing with anxiety, sometimes for the first time, globally, anxiety, isolation. And I found it really interesting that these 9 young people had all of these tools that they had been working on for years and years. And so that there was so much wisdom that they had to share. And it's not easy for them. And it's not like everyone's just fine. They're still recovering and they still have to, put one foot in front of the other and work on their issues, but they have tools. And I thought it was really interesting. I do think that as the pandemic has continued, there is an increase, especially in young people who aren't getting to go to school, who aren't, there's a developmental interruption. And I feel like Dr. Whitlock, you can probably speak more to that and how that would
increase. Yeah, Dr. Whitlock, feel free to jump in here because I think Alexandra makes some great points. Just the developmental process of kids right now has been interrupted, and they don't really know which way is up at this point. So what do you think is the biggest impact of the pandemic right now on teenage mental health?
I think Alexandria hit it right on. I mean, it's just the longevity, it's just day after day after day of the same thing. And I was struck by the same thing, like the young people that we were talking to had already developed such a suite of skills that they were able to deploy those pretty quickly. I do think though, as things have gone on, even young people it's not even just young people who have pre-existing vulnerabilities and have not been, you're not really hardy, are probably really feeling it. And I don't know anybody who's not feeling it. It feels like we're all in the depths of, wow, you just have to be with yourself a lot, you know? So there's when you have some experience doing that, when you're somewhat comfortable with that, it seems like those of us who have done that are probably faring a little bit better than those of us who haven't. I do think the one upside to all of this is we are in it together. I mean, we are all experiencing it together, even though it feels like it's a uniquely personal thing. I do think we're going to come out of this with a lot of questions and unknowns, and not just because of the interruptions, but because we're coming back into a landscape that's really unclear. None of us know exactly what real life outside of COVID is going to look like. And even more, I don't think we know what we want it to look like. So in some ways, that's what intrigues me the most. I mean, what will we create? What will young people create, fashion out of what's left? How will they pick up their lives? How will we collectively pick up lives? So there's risks there, but there's also opportunities.